Hello, everyone, and welcome. Thank you for joining me. My name is Jenna Vater, and I am the program coordinator of the Native American Pathways program at the University of Illinois College of Medicine at Rockford. I was asked to give a short presentation about the Native American Pathways program for National Rural Health Day. And I also wanted to give some background on Native health disparities and social determinants of health in honor of Native American Heritage Month, which is the month of November. So without further ado, we'll get started. I did want to first start with a land acknowledgement. I want to respectfully acknowledge that the University of Illinois College of Medicine at Rockford sits on the land of multiple tribal nations: the Peoria, Sauk and Meskwaki, Potawatomi, Miami, Wachati-Shikoan, and other indigenous sovereign nations have stewarded the land of the Rockford area for generations. It's our responsibility to honor these nations and to work with them as we move forward as a more inclusive institution. So for those of you who are new to the Native American Pathways program, I wanted to tell you a little bit about who we are. We are a student support program for Native American medical students at the University of Illinois at Rockford, specifically those that are in the Rural Medical Education Program, or RMED program. So we're looking for students that want to serve rural tribal communities once they are finished with their medical training. And another big part of what we do besides recruiting and supporting these students is we do our best to remove barriers to higher education that have been placed in the way of Native students for generations, which we'll talk about a little bit more later in the presentation. So how our program got started is a few years ago, before I was in this position, the National Center for Rural Health Professions, which is basically like the department that we're housed under, had a grant through the Kellogg Foundation. And Kellogg brought a bunch of their grantees together to talk about what these grantees were doing and how they might partner. And the concept of the Rural Medical Education Program, or RMED program that I mentioned earlier, was being discussed. And RMED for years, which recruits and retains and graduates rural medical students at the University of Illinois, that program has a grow your own philosophy. So they look for students that grew up in rural communities who understand the health needs of those communities and who want to return to rural communities once they finish residency. So that was being described at this grantee meeting, and there was a tribal member there from the Karuk tribe in Northern California. And he spoke up and said, you know, our community could use something like this. Our indigenous community could really use students from our communities who grew up there and understand what our health issues look like and what we need to see in physicians in our communities in order to build more trust. And there were also some community members there from the Wind River area in Wyoming who expressed an interest as well. So that's kind of how this got started, was this idea that rural indigenous communities also need physicians who grew up in those communities and understand those issues. And this is a need across the country. Throughout Indian country, there is a dire need for more Native medical students. If you look at data over the past few decades of underrepresented in minorities, underrepresented in medicine students, for most of those groups, representation has been rising over the past few decades. For Indigenous students, it has not. The line has stayed pretty stagnant. To give you an example, in 2019 and 2020, for that application cycle for students that actually matriculated into medical school, out of a total number of matriculants of 21,863 students, only 44 of them identified as Indigenous alone, not in combination with another race. So again, that's only 44 out of 21,863 total matriculants. So there really is a need nationwide for more programs like these. So one of the big reasons that there is such a need for rural Native physicians is that Native people suffer some of the worst health outcomes in the nation. One of those is lower life expectancy. On average, Native people generally live about 5.5 years less than their white counterparts, but that also varies by what part of the country you're in. So for example, in Wyoming, Native people on average live about 20 years less than their white counterparts. So that's obviously a pretty big disparity. There's also a higher burden of chronic preventable diseases in Native communities, such as chronic liver disease and heart disease. So these things that should be preventable in most communities are seen at a much higher rate in Native communities. And a lot of this stems from lasting effects of colonization. So different factors like historical trauma, which put simply is basically like group post-traumatic stress disorder from the violence and racism and discrimination that Native peoples have faced for hundreds of years. There's also lack of access to clean water and healthy foods. As an example of that, many people have been probably hearing more recently of the Navajo Nation's fight with the coronavirus, and it's difficult to, wash your hands regularly when about 1/3 of the Navajo Nation's reservation does not have clean running water. They don't have running water, actually. So it's much more difficult to maintain the same levels of health when you don't have access to basic things like clean running water. There's also higher rates of poverty in rural Native communities and overcrowded housing. And one factor that I really want to focus on for these health disparities is historic and current inequities in healthcare. And one of the reasons for that is lack of funding. There is chronic underfunding of Indigenous healthcare by the federal government. There has been for decades. And the federal government actually does have an obligation to provide healthcare to enrolled tribal members through treaties, which are the supreme law of the land. Which, to give an example, part of that obligation by the federal government for healthcare is there is an organization called the Indian Health Service, or IHS, which is a federal health program for Native people based on treaty obligations. IHS generally has a 25% vacancy rate in their rural IHS clinics. But also, if you look at spending per person in IHS versus more nationwide, you can see what a disparity there is. Generally in IHS, IHS spends about $4,000 per person on healthcare per year versus nationally, that's about $9,000. So since there's so little funding, a lot of people aren't going to be able to go in for preventative care because they know there's actually a saying in Indian country, don't get sick after June, since the funding is going to run out by then and you're not going to be able to get the care that you need. So when I was talking earlier about higher rates of chronic preventable diseases, that's part of the reason people aren't able to go in for preventative care. It also makes it very difficult to fill open positions. As I just mentioned, 25% vacancy rate in rural IHS clinics. And actually 75% of rural Native Americans live in health professional shortage areas. So that lack of funding really hits the quality of care hard. There's also issues with representation, which is really what our program is hoping to help remedy. So when you have physicians who are not Indigenous, who are serving in Indigenous communities, one issue that can arise is somebody from outside the community doesn't have the same cultural understanding as somebody from within that community. So you can have a lot of issues with cross-cultural communication and cultural differences that might not be understood by that physician. There's also a historic distrust of outside physicians and researchers. there's been a lot of abuse of health data and that sort of thing by physicians and researchers from outside Indigenous communities for many years, for decades. And one other big factor is discrimination and racism when seeking healthcare can be a major issue when providers are not from within that community. There have been many recorded incidents of Indigenous people not getting the care that they need because they might go into a clinic and someone assumes that they are under the influence of alcohol or something like that, instead of maybe having a cardiac event, something to that nature. So that is a very major factor when it comes to disparities in healthcare. And that's why programs like the Native American Pathways program are so important. We are looking to help support Native students who want to become those role models in their community, who have that cultural understanding and can build more trust with tribal members and with their patients, and who also can advocate for more funding in Native health. So that's really where we're coming from with our program and what our mission is. So for the Native American Pathways program, as I talked about earlier, we try to do our best to remove some of the barriers that are in the way of Native students who are seeking higher education. So we really have to get started in the pipeline process early with students, since not all of these Indigenous students are going to have access to the same opportunities that other students throughout the country do. So one thing that we do is talk with students in high school, usually at college and career fairs, or we do classroom presentations, talking about what it's like to be a physician and how you get to medical school. And we even step back even further and talk about just college prep and how to choose the right college that's for you, how to choose the right major, all that sort of thing. So students really have help every step of the way on the way through higher education. We also have done kind of some email blasts with high schoolers where they sign up for a mailing list, and we send monthly emails about different health careers. So different basics about, what each health professional does that we're focusing on, what their work-life balance is like, that sort of thing, what schooling you need, and then students can follow up if they're interested for more information. And lastly, we have a partnership with Wind River High School out in Wyoming and with the Rural Health Careers Camp here in Rockford that is run by our Assistant Director of External and Pipeline Programs, Vicki Ryan. The Rural Health Careers Camp is a program in Rockford that's about 4 or 5 days long, and it's a camp for high schoolers to learn about rural health careers. And we partnered with that high school out in Wind River to bring a few of their students here to Rockford in the summer for that program. So that way those students can get exposure not only to rural health careers, but also to what living on a college campus is like, since they get to do that for a week. And they learn more about financial aid and college prep and that sort of thing. So again, we're just trying to make sure that we reach these students early so they know that becoming a physician is an option for them, and also that they have people to support them every step of the way. We also work with students quite a bit who are in college. That becomes a bit more narrow focused on medical school. So I've worked with students before who need a little bit of transcript review, who might want to know what courses they need to maybe raise their grades in. We also make sure that they have all of their prerequisite courses completed for UIC before they apply. We've also been doing quite a bit of virtual advising sessions, especially this year with the pandemic. That's allowed us to reach a lot more students nationwide, which has been great, just to sit down with students and learn about their goals and kind of give them steps to better prepare themselves for the application process for medical school and becoming a better physician one day. Let's see, and we also, this is a little newer, but we do, I mentioned guidance with the application process kind of goes hand in hand with the virtual advising sessions, but the newer initiative that we're just becoming a part of is the Great Lakes Native American Medical School Application Workshop. And that is a workshop for Indigenous students in the Great Lakes to talk about the application process for medical school. And they get access to advisors from several different universities in the Great Lakes area that all specialize in supporting Indigenous students. So it's a really great opportunity for those students to not only learn about different schools that they could go to, studying for the MCAT, how to write a personal statement, but they also get to connect with other Indigenous medical students from around the Great Lakes, so they can kind of get a better sense for, you know, what life might be like as an Indigenous medical student. Then once students are in medical school with us here in Rockford, we work with them as closely as we can throughout their 4 years here. One thing we do that I think is very important for Indigenous students is we work closely with admissions when we have Native students coming through the admissions process. So as I mentioned even earlier when I was talking about high school students, not all these students are going to have access to the same resources as some of their peers. So we make sure that we work with admissions, looking at these students as a whole person, not just as an MCAT and GPA score. We also do offer in-state tuition for Indigenous students, which we all recognize that medical school is not a cheap endeavor. So we want to make that as easy on our students as possible. And we also offer scholarship assistance. So any student can come to me and let me know that they're looking for scholarships, and I compile a personalized list of different scholarships they can apply for, and I help them, I help look over essays and that sort of thing to make sure that we can, again, make this as easy on our students as possible. I do also act as a student advocate on campus, so that's something that can be a little more special about our program than some others, is I am always available for our students if they have any issues, whether it's classroom related or if they're looking for a new apartment around town and aren't sure where to look. I'm always happy to help with anything like that. And lastly, one of the bigger things that I also work on campus is our preceptorships. So all fourth-year medical students in the rural medical education program do a 16-week preceptorship in a rural community. So I work with students to place them in rural tribal communities for these preceptorships. Currently, we have opportunities in Northern California and on the Wind River Reservation in Wyoming. Both have been really great experiences for our students. And during these preceptorships, students do, they complete community-oriented primary care projects. So I provide guidance for those projects and make sure that they are on topics that the tribes are actually interested in and will benefit from. And we also make sure to work with local organizations and community leaders who are doing positive things in the community, since we recognize there are so many people out there, so many Native people that are already working on all of these health issues that we've been talking about. So we want to do everything that we can to support their efforts to better their communities and their health. And one more great thing that we have on campus that I wanted to mention is the University of Illinois College of Medicine has the Urban Health Program, or UHP. And UHP's purpose is to recruit, retain, and graduate underrepresented racial and ethnic minority students, specifically African American, Latinx, and Native Americans into the health professions with the goals of eliminating health disparities and advancing health equity. So UHP is a little more broad, whereas our program focuses on rural Native American students. UHP has a broader focus and supports students from all different underrepresented racial and ethnic backgrounds. So it's a really cool program on campus that I just wanted to highlight for everyone, since we do partner with UHP periodically to make sure that our students are supported. And UHP has some really great offerings like a lending library. They help with career development, letters of recommendation, academic success strategies. So if anybody would like further information about UHP and their offerings, feel free to reach out to me and I can put you in contact with Rockford's UHP director, which is Brenda Fisher. All right, thank you everyone very much for tuning in and listening to me today. Again, I think programs like these are really important for supporting rural health. We need more rural Indigenous doctors to fill all these vacancies within IHS and fill some of these gaps in these health professional shortage areas that we mentioned earlier. So if anybody has any further questions about our program or anything else that I talked about today, please feel free to reach out to me. My email is there on the screen. We do also have Facebook and Instagram if you would like to follow us on there. So thank you, everybody. I want to wish you a happy National Rural Health Day. And please stay safe. Have a great day.